Regardless of what sport your teenager plays, and whether they play at a highly competitive level or whether they play for fun, we know that they want to win very badly. But we also know that equally, if not more important, is keeping them safe. My name is Dr. Robert Wainer, and I'm with Murphy Wainer Orthopedics. And I'm going to talk to you today about what the warning signs are, what to look for, and how to keep your teenagers and kids safe when they're playing sports at whatever level they're doing. When we talk about factors that lead to injuries, there's some things I want you to understand first about what an injury really is. Injuries can be from one particular event, such as you're running down the field and you go to make a hard cut and your knee gives out. That's one particular event. Or an injury can come from overdoing the same activity over and over again. We call those overuse injuries. And the problem is that not always do you pay attention to the pain. The young athlete may want to just continue to throw because they don't want to disappoint anybody, and so they continue to throw in pain. So the way to prevent an injury in throwing is not only to make sure your arm is strong, but also to make sure that your whole body is strong. So we really stress core strengthening for our throwers. That's true for not just baseball. It's true in tennis, because it's an overhead sport. It's true in volleyball because that can also be an overhead sport. It's true in swimming. So the one thing we tell all of our coaches and our parents when we're talking about their kids playing a sport that involves using their arm is, number one, if you start having pain, immediately stop. Because the more you throw or do anything in pain, the more you're going to do more injury. Then we go back and say, okay, you take some time off. You do a lot of stretching. Stretching is very important in any sport, whether it's baseball for your arm or your hips, you have to stretch those too. Whether it's football or basketball, where we stress a lot about stretching the lower body. But the stretching is important, the strengthening is important, and then resting. Resting is really important, and so we stress that a lot. And so when you feel like that you've done the strengthening and done the stretching, and if there is pain, and you've taken a week or two off, yet you've continued to work on the rest of your body, and if the pain is still there, you need to see us. We see a lot of times that, especially in the summer when these summer leagues will start up, that the kids will start playing on two different teams. And so one team will play on the weekends and another team will play during the week, and all of a sudden, you don't realize it, but they're playing every day and there's no rest, there's no downtime. And so we can see a lot of injuries from that standpoint. We see it in soccer, we see it in baseball. So playing on multiple teams at the same time is a real warning sign that an injury may be brewing. And again, if something starts to hurt, you have to stop. The other thing that we see that goes along with this is that there are many times where there are big tournament weekends, and there'll be 3 or 4 games a day on a Saturday and then on a Sunday. And that's also a potential recipe for a problem. So really paying attention to the amount of time that the young athlete is playing when you don't think it's a big deal, but if you start adding it all up, it's an incredible amount of exposure to the same sport, the same stress on their body over and over again. Just remember, at the end of the day, it's equally important not just to win and to outscore the other team, but also to make sure that you stay safe and healthy. So thank you. Now, for any other information on these topics, go to conehealth.com/orthopedics, and you can find all that information that you need. Thank you.